Well, thank you so very much. My name is Dr. Abigail Mpambi. I'm a social advocate, a human rights defender, and of course, I'm a political scientist. I've never shared that I'm also a journalist.
Oh, okay.
Yeah. But well, let's talk about the issue of the moment, the remarks by the youth minister, Honorable Tino Machakaire. I'll put it to you that let's just say this has been the buttressed remark. This has been the voice of the people across the divide. And personally, I feel that Honorable Machakaire, what he said is true, but the perspective, how he brought it out there, I think it's not sincere. I'll put it that way.
Why do you say it's not sincere?
Yes. Why? Because he is and he has been in a position of action. For a cabinet minister to probably jacket his remarks more like a lobbying position or an awareness position instead of him committing by way of action and bringing answers to the public, I think it's coming in as a deterrent because he even, in my view, worsened the scenario by actually saying, I had a sick relative. It's only then when I became conscious.
When you realized
of
the magnitude.
The magnitude. And remember, this is a public official seconded on a mandate of such a big demography. The youths, these are the very people who have got their wives in hospitals, trapped there in the active population with our kids. They are the maternal health issues. It's catching up with the youths. So who has he been probably representing all along? Because when you are representing a constituency, you are representing it in principle and in action.
And I'm sure there are people from his constituency that have fallen sick at one point in time and asked for his assistance.
Look, it's a simple issue. He is actually the ears and the eyes of the president. So to spin this back and begin to say, where is the president? Please come. Actually reporting via social media. For me, I think it is, like I've quoted my words, I think it's some sort of reverse psychology, probably to make us think that maybe he is desperate of a way to reach to his excellence, which is not true. Probably he's even trying to find ways to speak to the Minister of Health, Minister Mombeshora, which is not true. And of course, openly, he knew about the state of our health facilities.
But there is a clique, or there is a conspiracy theories around this, where people are saying that it's all grandstanding, and we'll see the president emerging as a listening voice after Honorable Minister has posted about the state of health facilities in Zimbabwe. Would you subscribe to that line of thinking that it's all a grandstanding?
Even if the president is to act today, I'll tell you this, he is responding to the voices of the masses. Why then should we think that a questionable single voice is what he's responding to? I'm not trying to be hard on him, but I am disappointed, of course, with the remarks. The president has done a number of projects in the country. Some we may term them success, some whatever ratings that we may give, but responding to his mandate, responding to the cause by the masses, responding even to the concerns raised by opposition leaders why would we probably be made to believe that the president needs a grandstanding from Honorable Machakaire for him to respond? If anything, I want to believe that there are a number of projects that the president has responded, probably even tabled by him, Honorable Machakaire. We have seen a number of galas and all this youth activities that has been happening. We saw the National Youth Service, where, of course, the Minister of Youth, he himself, Honorable Machakaire, has been actually coming out to say, we want to thank His Excellency responding to the calls of the youth in a number of ways. So why would he, at this juncture in particular, respond to the health crisis, if I may put it, staged probably in some form of a grandstanding by Honorable Machakaire? He can instead respond to this as a submission from the Minister of Health. There is a Minister of Health. I want to believe that people may take this light, but I think I was thinking about this. I think my brother, Honorable Machakaire, I don't think he is up there to the level of a grandstanding or whatever. I just think that he just misfired. He just miscalculated. Maybe he was excited. I'll put it that way, because he has the conducts of His Excellency. Right now, as I'm sitting down with you, he might be in the cabinet right now. And what is he doing? Submitting.
It's a Tuesday. Yes, there is cabinet meeting today. Doc, as a political scientist, could this signal the factional fights within ZANU PF, or we are now dwelling too much on the issue of statement raised by Honorable Machakaire to tie it together with factional fights?
Well, talking politics. He may be caught in a crossfire. At this juncture, personally, I want to believe that he was a little bit. It's not right to say down to an honorable minister. I respect his office, but I think he is not up there. He will be caught definitely in this factional crossfire, because he has subjected himself. He has opened himself for such, and it's very, very unfortunate, because when a home minister appears to be reporting to the public, when there are channels within ZANU PF, when there are channels, some informal channels, they talk to each other, these guys, and when there are even channels, we are talking of cabinet now.
But Doc, if the honorable minister had used the proper channels, the public or the masses would not have known that there was an issue that was raised. So I think this is either way. This could be a victory for the masses. Because the masses now there's a voice that has been added to the masses. If he had taken proper channels, we were not in a position to know that there is this.
Look here, we don't even want to know that there's been something happening. All we want is to have a fixed health system. We are not even worried. This is why we don't even poke into what is being discussed in the cabinet. We don't care. What the people want to see is a functional health system. So, for me, this is why I am saying his remarks are misguided. We are not even expecting that from him. All we want from him are answers, and probably a request to say, I have this idea. Please also contribute your own ideas. A forward-thinking kind of approach. So for me, this actually is a disruption and a deterrent that I'm witnessing. He has a manifesto that speaks to health. He has got the economic blueprint that speaks to health. He has got so many instruments. Even he has got access to convince some budget allocations from galas to health. So for me, I think that this is a deterrent. What I can probably sum up and say is that outside any other politics that may be taking place. I think that the Honourable Minister must just sum up his submissions and find a proper way and probably quickly respond by way of action as a government, because this issue, for record, I know that government should have been seized with this. And His Excellency, grandstanding or no grandstanding, I want to believe he is going to take action, not because of Honorable Machakaire, but because of the concerned voices and the plight of the people of Zimbabwe. So this issue of creating grandstandings with such crucial issues will just take us into unnecessary controversy. We need our respective honorables to just focus and bring us results. And we are not saying they must work, of course, or on their own in isolation. They have a role to coordinate smooth flow or implementation of our key programs into within our government systems.
Thank you so much, Doc.
Thank you very much.